This is a great question, and it's in regards to that situation about the patient that was post-op. We don't know what kind of surgery they were post-op, and they were experiencing respiratory issues like shortness of breath, dyspnea, things like that. And so Nami, she says, I have another question regarding this. If I happen to encounter this question and the choices were to, one, obtain vital signs, or two, elevate the head, what do I do? You elevate the head. And here's why. I don't want you to memorize. I want you to understand why. Just in case, it's the question is asked differently, you can still figure out the rationale to get the correct answer, okay? So the reason why you're going to elevate the head instead of checking vital signs, because I know what you're thinking, okay, ADPI nursing process, the first thing you're going to do is assess, get information. You got information when you saw that patient was short of breath and they had dyspnea, right? So with that being said, if you chose vital signs, what are the vital signs going to tell you that you don't already know? A patient just came from surgery. They cannot breathe. They're having respiratory issues. We know it's the lungs. They can't breathe. What are the vital signs going to tell you that you don't already know? What is the temperature, the pulse, the respirations, the O2 sat going to tell you that you cannot already see? Because in the question, it already told you the patient was having respiratory issues because they had shortness of breath, dyspnea. Do you see what I'm saying? Don't choose an assessment just because it's an option. It has to make sense. You have to say to yourself, what is this assessment going to tell me that I don't already know? Because if you already know, your next action is going to be a nursing intervention. Does that make sense? And that's how you're supposed to think when you get these type of questions.